So when you take measurements, some things are not medical reasoning. It's just, okay, I take measurements because the machine do not. Now the machine does, so I have more time to think of my medical diagnosis, anatomical particularities, etc. So it gives me more time for human and medical reasoning and less time for standard measurements. Another point of view, I can have the same thing, the same reasoning in less time. So either I have, let's say, 7 minutes. So 7 minutes traditional. Now I have 7 minutes with 2 minutes more for reasoning. Or in 5 minutes or 4 minutes instead of 7, I have the same results. So either I gained in medical reasoning or in time that I can use after in my office for medical reasoning or human relationships. Sometimes 2 or 3 minutes more to explain the results to my patients in the same global time can change a lot. For example, after terminal ablation, sometimes the shape of the nodule is not, it's not round. And with traditional measurement, you cannot know if the nodule decrease or not. With PIUR Infinity, sometimes either I reassure myself I don't have to perform a new final aspiration biopsy to say the patient it's not good because it decreased, or at the opposite, okay, with PIUR, I see that I was wrong with conventional measurement. This nodule is re-increasing. I will perform final aspiration biopsy because we know that in these nodules, 20% are missed cancers. So it can completely change my practice. Of course, and I think now that this system has, I know, for example, that you have the project for extra thyroid structures, and they are very important because thyroid disease are linked to lymph node disease. For example, when we follow up thyroid cancer after surgery, or where we are looking for parathyroid disease, parathyroid adenoma, and then scanning the whole neck to be able, after this, to see precisely, because when you perform the ultrasound, you only see the image on the screen. Okay, that's ultrasound. With the scan, you have another view, and you can find something, sometimes parathyroid adenomas you did not see with conventional ultrasound, and then you change the surgery. Sometimes you are able to perform thermal ablation. So being able to spot the parathyroid adenoma totally changes the therapeutic. Of course, because first, for the patient, you can explain where are the nodules and what are significant nodules. Second, for yourself, the follow-up is easier because when you have sometimes 7 or 8 nodules, it's very heavy, it's a very long exam, sometimes discouraging. It's not discouraging anymore because you have the drawing and you can compare them sometimes. Third, when you talk with other doctors, surgeons, for example, they have the drawing, they have the map, they know where they are going. And if you do a scan large enough, you can see thyroid ectopia, for example. I had an example just yesterday with a patient who had a little ectopic thyroid tissue between the salivary gland and the thyroid. And it's very important for the surgeon who must sometimes remove all thyroid tissue. And if you do not say there is something here, he doesn't have PIUR technology in the eye. Times people get operated because And it's true, it's everyday life, because doctors said, your thyroid is too difficult to follow up, remove it. That's a truth. That's something you see every day. And it's unacceptable. With PIUR technology, they cannot say, it's too difficult to follow up. I would recommend them because they are going to be, as I said, more performant in quality of care. They will gain time they can use for medical reasoning. They can use for explaining patients. They can use for themselves, because in a very heavy day, they have to take care of themselves, and that can help. They have the choice for this time they will gain to be used as they want. They will have a wonderful communication tool. They can see if they have a doubt in the end of the day. They can take the scan and reanalyze it if they want. If 1 year later they see something weird on the image, they have the whole movie, so they can watch the whole lobe. You will gain time for a better result, and that this would be for the experts. And for beginners, I will say you will gain time for a better result, because beginners, they need time. They need time because they don't have the reflex for the thyroid score, for example, etc. So I will say that today in 2025, time is the most precious tool for doctors.